working on a little thing, kind of a little thing, but I honestly believe it is the answer to the healthcare crisis in America. Ooh, that's a big vision. I have a big vision. It's a big mission.
As a clinician looking at this, there's no science here to what you're talking about. I have no specifics. You're talking about
Can you, as a clinician, say that again, please?
I didn't see any science in your presentation.
I think what you're proposing is not only interesting, I think it is potentially expanding the role of dentists in healthcare.
Amen.
It's an honor to be a dental tank. We're looking forward to meeting all of the great startups here and all the people that attend.
Just started my 52nd year in this business. I've done so many different things in this wonderful industry, working with so many wonderful inventors, entrepreneurs, practitioners.
What we do is we evaluate products, and we take those products, if we love them, and there are those we don't, and we take those products and we bring them full force into dentistry.
I'm looking forward to hearing everyone's pitch and seeing what's out there, what you've built, why your product, why your company.
So those are my 4 filters: bigger, faster, easier, cheaper. If you can answer those, I'm going to be very interested in investing in you, either with dollars or with time or with my reputation.
Really looking forward to what we are going to see today, and hope everybody enjoys the event.
And let the games begin. Last year, or last April, it seems like last year, some of you may have seen this amazing, funny guy on the stage. He was going back and forth with Dr. Lou Graham a lot for timing and staying on time. And he's like, man, I actually would love to pitch on Dental Tank. And this is Dr. Chris Kammer with Victorius Dental. His business description is a no-shot, no-drill dental office that halts decay. And without further ado, Dr. Chris Kammer.
Thanks, Elijah. Hey, all right. So you heard, I'm working on a little thing, kind of a little thing, but I honestly believe it is the answer to the healthcare crisis in America. Ooh, that's a big vision. I have a big vision. It's a big mission. And it's kind of too big for one little old guy like myself. That's why I may say, hang on to your checkbooks for now. What I'm really looking for are mission partners to help me, to help this kid with a dream make this a reality. Okay? So Elijah gave you a little hint about what it was about. I've had some experience with making visions into reality before. Thankfully, because it's in my blood, my father, Dr. Jack Kammer, founded the American Academy of Cosmetic Dentistry, the biggest cosmetic dental academy in the world. I'm his kid, and I was there at the founding meeting. My father taught me that when you've got a dream, you've got a vision, go for it. And thanks to my father, when I got tired of seeing bleeding gums and learning that your oral health impacted your systemic health, I said, this message needs a voice. And I founded the American Academy for Oral Systemic Health. And I've been thankful to see our membership and our meetings reaching up to 1,000 members per scientific session. So I have this in me that can, thanks to my father, that can make the dream into a reality. That's kind of what I believe. All right, so here's the big one. And this is the biggest. And of those 2 things, this might be the biggest thing I've ever embarked upon. I am so glad and I'm so excited. And but it might be too big. That's why I might need, I absolutely need mission partners. Because dentistry is going under right now a transformation that you're not even going to believe, although you might have heard about it. Did you know or did you hear that tooth decay can be healed with medicines? It can be halted with medicines and healed with medicines. Yes, it's true. And so the day of the drill is coming to an end. I, for the last 2 years, have been using the medical approach to treating tooth decay. The other lane in dentistry is the mechanical approach. See tooth decay, get out shot, get out drill, cut, 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 amputate tooth structure. Those days are coming to an end. For the last 2 years, I've been using a medicinal approach. This is called the medical management of caries. It might be a term you've heard, but it's coming into vogue. It's real. It's not going away, just like my father's Cosmetic Dental Academy, just like the oral systemic connection of AOSH. And so I'm here to further that. The mission of what you could say is to drop the drill. Don't default to amputating tooth structure, not when it can be healed. I just kind of wanted to make sure I got it right here. But what if you could become a dental healer instead of a dental destroyer? Oh, these are harsh words I'm saying to a dental-friendly audience here. But if you were to but the hard part about becoming preventative or healing practices, what's the business model in that? So my mission, of course, I know this won't work until we can turn it into $1 million, so that these dentists can have $1 million practice with the take home of $1 million practice, right? Because you never take the whole million home, it's not yours. But I want them to be able to earn that from $1 million practice with less stress, almost zero overhead, few to no employees, and the best feeling from not putting people into that downward spiral of declining oral health and systemic health. You know that over 50% of all the procedures being done in the dental community are just because a dentist already did something to them already. Repair and replace. I'm gonna change that with halt and heal, okay? So that's what we're doing. So here's the problem. This is a toddler in the hospital surgical suite with a team of medical professionals, and this is a dental suite, so they are amputating and anesthetizing and deep sedating a toddler. Do you know that they don't even know what impact that has on the developing brain right now? Yet day after day, how many of these happen every day? Today, there will be 1,000 of these situations going on in the United States. I'm here to put an end to that. And that's the tip of the iceberg. The tip of the iceberg, because that's maybe the worst that could be going on. But also, there are hundreds of thousands of dental drills being plunged into teeth, destroying tooth structure. Yeah, it might be diseased, but you know what they do in medicine when you have disease? They use medicine. They use medicine, right? Makes sense, right? But dentistry for 100 years has had the same darn approach to tooth decay. Amputate it. Cut it out. Those days are going away. They're over. So this is my mission, to change all of that. I'm doing it with a medicinal approach. And the medicinal approach has been recommended by the ADA, American Dental Association. It's been approved as safe by the FDA. The FDA has even targeted one of the medicines as a breakthrough technology that is being sped to market. And also the World Health Organization recently acknowledged these medicines for being essential for health. Okay? So I've got the backing of all of these institutions, and I'm on a mission. And just like my father, who got the American Academy for Cosmetic Dentistry started, and I've done it before. I'm going to do it again. I'm not leaving y'all till I get this done. But yeah, it's a big mission, but I'm looking for mission partners. If anything that I'm saying sounds like something that you want to leave as a legacy to the world, you might want to consider being a mission partner. Other things that I've done, I've been in the dental space, cosmetic dentistry. I was voted Madison's best cosmetic dentist. Okay, fine. But in the oral systemic realm at my organization, AOSH, because I would test saliva, test blood, look at carotid arteries, look at antioxidant uptake, I was given the Lloyd Rudy Award for being a leader in the oral systemic realm. So I've got that going on. I know how to get attention to. When I saw that there was Halloween, was always sort of a challenge for dentists, I created the Halloween candy buyback. Maybe you've heard about it. Certainly Diane Sawyer heard about it, and she invited me to be the person of the week on ABC World News Tonight. So if I see something that I think I can make it better, I take it to a national level. What? I took an oral systemic message to American Idol. Huh? Yeah, because that opens doors. You know, sometimes to get the message across, you've got to be entertaining. So my goal is to drop the drills. Sound wild? It's a way bigger picture than I can explain in 10 minutes. That's okay, because I've got an invitation for you. But when you drop the drill, you drop the shot. When you drop the shot in the drill, there's no aerosols in the room. There's no suction. There's no pain. There's no overhead. You can do this almost with no staff. This is amazing. This is the new lane in dentistry that I'm opening up. The other lane is where 99.99% of people are going now, right? When you create a new lane and people have the opportunity to go to a healer as opposed to a dental amputator, where do you think they'll go? So my broader mission is to revolutionize healthcare. This is just the door that opens up to a broader picture of systemic health for a lifetime. And so it's all about saving lives. I have done the gums of steel oral systemic testing. I know that what we do and what we look for and what we see in the dental realm can impact lives and help people live longer. And where does this start? It can start at age 1. We can bring people in at age 1. Like I said, the American Dental Association recommends this care that I'm doing in this business model, which is also a vision and a mission, and I'm looking for mission partners. They've recommended this care. But do you think that every dentist is going to go, hey, that's wonderful? No, it doesn't fit the business model, which is mass production of procedures. And that is, you know, when you get out of dental school, you're $500,000 in debt, set up a practice, there's another $1 million. There's temptation to do the big money procedures. My mission is to create that financially solvable, that financially feasible model that pays people to be healers and not dental destroyers, not amputators of dental structure. So I'm holding a private partnership meeting Saturday, December 4th. If anything that I've said is of interest to you, to change dentistry like it's never been changed before, this is the time. I've got some key mission engagements. Some of the things that are involved in here that are unique are my gums of steel treatment protocol, where I do the testing, the bacterial testing, the inflammation testing. I look at visceral fat. I do a higher level of screening than your primary care doctor will ever do. We've got the Victorius dental mobile app that is going to create a network of people, functional medicine doctors. I've got the solution. It's deeper. You want to hear about it. And the big thing is I've got exclusive use of an antibody, of a protein antibody that will reduce gut inflammation. If you've got SPLA2 in your gut, and you all know about the gut biome and the relation to the whole body health and the mouth health, so that's another big exclusive to this model addition to this. So if you could see dentistry being as the door that opens up to better oral health, no procedures, you know, that's the new lane. You're born healthy, stay healthy. And that's the lane I'm creating. And when people know they have an opportunity to go into this lane, where every little bit of disease looks like something to put a drill to, or this lane, where you can stay in this lane for a lifetime, and it includes the medical network, the health and wellness, and the dentist that's never going to put a drill to your teeth but be a healer. That's the thing. So thank you very much.
The only way I see this, unless a practice starts out this way, is this can be incorporated into an office, and I just don't think you need to split the office. You can guide the office down a path for the future.
Imagine having a practice where your patients are excited to come back to your practice.
What if your patients were so loyal they would never even consider going anywhere else? And what if it was as simple as this electric toothbrush?
And that's why we created Sauna, the newest way to get your patients coming back by extending your care beyond the chair.
Let's face it, patients do not think about you the second they walk out your door because they're indifferent.
And it's just a matter of time before an indifferent patient doesn't come back.
Give your patients a reason to care. That's what Zana does.
How? By giving your patient an electric toothbrush, private labeled, so you can stay in front of them 2 times a day, 7 days a week.
And get your patients actually excited to come back to your practice because you're going to give them free toothbrush replacement heads for life.
Stay in front of your patients.
Give them a reason to come back.
Join Zana today, the electric toothbrush program redefined.
And get your patients coming back by extending your care beyond the chair.
It's great to see you, first off, Chris.
Thanks, Lou.
It's really great to see you. So I'm going to ask you, I love all of this, obviously, but is there kind of a way to acclimate this to a practice where it's not all or none? That's how I'll start off.
Thank you for that question, because Lou, I've been in the oral systemic space. I mean, I helped it emerge. And every doctor in that space is already kind of as busy as they can be doing root canals and TMJ and cosmetic dentistry. And it's like the purest path, thanks for asking that question, the purest path from the oral to the systemic is don't become a reparative reconstructive. You got to move away from that. It's too much. And yet the joy and the feeling of fulfillment and the zero stress of being a healer leads you better, and it's the purest path. You know, you're born healthy, Lou. Let's keep people healthy. Let's have them stay healthy. The good news is they can come into this model at any age. So whether you're 1 year old or you're 55, come in. We'll give you the best that you can have, the alternative treatment to the drill and fill model, which once again is mass production, destruction of tooth structure. I said it, but thanks. Great question. And the reason, Lou, the reason I think it's got to be separated is because there's too much temptation to pull that drill out and do the big money procedures. That's why I need your help to make a healing model in dentistry a financially feasible option for dentists, whether they're coming out of school or whether they want to retire into this model. Listen, I've been a dentist for many, many years, pushing 40, and I know what it's like to be under stress and have all that amount, and to maybe move away from it. And the joy I have felt for the last 2 years, any practicing dentist will take a breath of fresh air and go, man, this is living. This is healing. Every single patient loves what I'm doing, and they're thanking me. It's so fulfilling, but it also is a great financial model, and we're making it better with all the partners. This is not just me, by the way. I have a team behind me that is working on the app, that's working on that health IP, that nutritional, that acts as an antibody to your SPLA2, that inflammatory enzyme going on in your gut. This is mind-blowing stuff. And so you can meet all of my team and come to this Saturday, December 4th, private partnership summit by invitation only. But see, and before you even can come to that, I want to know what you heard from what I've said that sparks your interest, that makes you want to be a part of this movement. Can you see that dentistry is about to be split down the middle, and maybe even more? That people given the choice are going to want to go to the dental healer, the dental halter of decay, someone who can get your gum disease under control so that you can, and then that transitions so smoothly into a network of functional medicine practitioners, all joined by the app. You got to hear how this works. And the people that use the app are actually rewarded when they are doing the health practices that keep them in that healthy systemic lane. It's never been incentivized like this before. This comes from greater minds than my own, and that's why we've all partnered up together to create this most amazing model that will change dentistry like it's never experienced before. This is the biggest disruptive thing in dentistry ever. I'm sorry, any other questions?
Yeah, I've got a couple. First of all, I love your passion and your excitement on this. As a clinician looking at this, there's no science here to what you're talking about. I have no specifics. You're talking about
Can you, as a clinician, say that again, please?
I didn't see any science in your presentation.
You've not seen the science. I don't have time for the science.
Yeah.
Trust me, the science has been looked at by the American Dental Association, the FDA, and the World Health Organization. When the World Health Organization tells us that the science behind these medicines is essential, that these medicines have become essential, in other words, this has never happened before. Dental medicine deemed essential. Now, to me, essential means go there first. Do this first. Get this to the people. This is essential. World Health Organization didn't come out and say drilling and filling a tooth is essential. They just haven't said that yet. So that's an archaic model of treating tooth decay. Why are we as a profession still cutting out and amputating tooth structure? When if you have strep throat, your physician's going to prescribe you some medicine. Why don't we use an antibiotic topical solution and other medicines to heal tooth decay? It's being done. It is done. It works. It's science. It's evidence-based. The ADA has proclaimed it as recommended care, but it's not going to be embraced by the dental industry. Someone needs to get in there and create that new lane. That is me.
So big change like you're talking about here, to get the kind of acceptance you're looking for, that kind of education has to start in our dental schools, right? Is there any progress being made into getting the concepts that you're preaching today into any dental schools?
Okay, so the problem, well, my concern about dental schools, even the dental organized dentistry, is that they're all kind of supported by what we used to say, the man, right? Or, you know, the bigger picture, the money. Let's talk money, right? This goes against all of the money that's currently supporting everything out there in dentistry. But it's what the people want. It's what the children need. Do you want to see more children going into the hospital? You know, like, this has to touch your heart. This has to spark your interest. This has to make you say, this is the legacy I want to get involved in, because what Kammer is talking about here has got to come to fruition. This has got to happen. So I think, you know, dental schools, speaking of dental school, they always come to the party a little late, right? I mean, all the innovation's kind of going on outside of dental school, but they are and must be teaching this because it's out there. Every dentist knows it's out there, but it doesn't fit the business model, and they just don't get it because there's more money to be made elsewhere. But that's why we got to make the money in this space, and what a legacy we will leave for our children and our children's children and the world.
Is your ultimate goal to make this more profitable or less profitable for the average dentist?
I can't be concerned about the average dentist, because right now the average dentist is looking at every...
You said more than half would perhaps switch to this method.
Well, great question.
That would be average.
In other words, because the temptation is always going to be to drill, I want people to have satellite clinics that maybe feed into the dental office. But if someone's going to come to somebody with this model, they have to have the assurance that someone's not going to pull out the drill. It's got to be a standalone healing, halting, and systemic health model that will help people live longer and better for a lifetime. Thank you for that question. I think I got to
just a quick comment here. I love the passion as well. I see some parallels to the conversion from mechanical dentistry to aesthetic dentistry in a behavioral change you're asking of practices. Having participated in that, in that change, I know how expensive and how labor intensive it is on the part of industry to help move dentists from a mindset to a new mindset. I think what you're proposing is not only interesting. I think it is potentially expanding the role of dentists in healthcare.
Amen. Yes.
So from my perspective, I think you're on to something that is definitely where dentists need to go. So I'm very interested. I too need to know more about the science, but I'm very, very interested.
Thank you.
Typical. Here we go, because just no time. I'm just going to make a comment because this is how we know each other. I think great idea, but it can't be all or none. I think you will be really, really challenged. I think implementing this into a practice that does still do traditional dentistry to an extent. But the only way I see this, unless that a practice starts out this way is this can be incorporated into an office, and I just don't think you need to split the office. You can guide the office down a path for the future. That would just be my closing comment, Chris.
Thank you so much, Lou.
Appreciate it. Thank you, Lou.
Give it up for Dr. Chris Kammer.
The majority of the dental tank participants there, the investors, had great questions for me afterwards. So that made me feel really good.
Meet Abella, your dental practice's new best friend. Abella helps you collect more past due balances faster by offering patients a superior experience to paying online, giving practice owners, office managers, and patients another reason to smile. Abella, the accounts receivable solution.
Well, I just had a great experience doing the dental tank, and what a great group of minds, that I was able to speak to, all the investors and business model creators, and it was fantastic. I was a little concerned because I'm talking about something that's so disruptive in dentistry. It's like one of the gentlemen out there was, got his whole start in making better drills. And I'm the guy coming up there saying, let's drop the drill. Let's get rid of the drill. Let's heal teeth with a medicinal approach. So a little concerned about that. But yet that gentleman asked some of the best questions afterwards. And so I was very honored to stimulate those questions. In fact, the majority of the dental tank participants there, the investors, had great questions for me afterwards. So that made me feel really good. Like, wow, they got into it, even though I was sort of speaking of a kind of very, very lofty goals. But see, that's one guy. I'm just one guy. And that's why I'm here in the dental tank, to find mission partners, somebody who says, yeah, I like that idea. And I wasn't really asking for their money just yet. More or less, can you get on board with this mission? Would you want to help me make this new lane in dentistry that is a healing, medicinal approach, not a mechanical rip out the tooth structure amputative approach, but a healing, a halting decay, a healing decay, and using ADA recommended medicines and FDA approved medicines for safe, and FDA breakthrough technology medicines that not every product gets to have that. And then I talked about the World Health Organization that just recently said that the medicines that I'm using in this model are essential. Essential. That means you got to use them. That means it's like, how could you not? Yet the business model of dentistry is all about, drill and fill and bill, I guess. And so there's always going to be the temptation in dentistry to pick up that drill and use it for the most expensive or the best financially lucrative procedure. That's why I am on a mission to make a healing and preventative model financially lucrative for every dentist out there. Now that means also whether you're coming out of dental school or whether you're retiring to a simple model with less stress, less overhead, less staff if you so desire. That's what I'm trying to share. So I really appreciate that I got so much interest from the participants. So I'm giving them Dental Tank an A+.
Dentistry has a problem, and it's a big one. We need more patients. And the patients that we have, we need to do a better job of getting them in for more services.
You said 550 consults per day. Okay, to me, that's a startling number for any dentist.
$2.5 million for 20% of the business. That's a $12.5 million valuation, 10 times revenue. How'd you come to that number?
This is a new process, and we're learning and we're getting better. But they all agree it's the way of the future.
Hey everybody, welcome to Nashville. And what is this Nashville event all about? Well, first off, I can tell you this. When you purchase a ticket for the Dental Festival in Nashville, you'll be purchasing a ticket that allows you to go to up to 20 different dental conferences. These conferences are usually located all throughout the country at different times, but we've brought everybody together at one place to collaborate. So we're gonna be at the Omni Hotel, the Joseph Hotel, and the Tri-Brand Marriott hotels. Those hotels, literally, you step out the door and you walk across the street. They're all there. And what it looks like as an attendee is each day you get to pick the conference that you want to go to. You only need to purchase one ticket and you get in to all of them. Another really cool thing is that we believe that fun is extremely important. We believe that you learn 10 times faster when you're having fun. And so we believe 50% should be education and 50% should be amazing fun and experiences that you will never forget. So welcome to the Dental Festival in Nashville. So here's what I'm gonna tell you. This event is the 6th through the 10th of July in 2022. And if you wanna come for 2 days, 1 day, 3 days, or 4, that is completely up to you. Same cost of a ticket, and you just pick the conferences that you want to go to. It's totally up to you. We have a central vendor hall where everybody could go and learn about all the different products and innovations in dentistry, and we have separate conferences throughout the entire event that you get to choose from. So whatever you want to be educated on, I'm sure that we have it. Make sure to get your ticket as soon as possible. The sooner you purchase your ticket, the cheaper the ticket will be. And please remember, if you don't like fun, this conference is not for you. But if you like to have the time of your life, Dental Festival's for you. I will see you there.